This is the F20, and you have two options in the F20. You've got the Air Touch, which is a memory foam cushion. And then you've got the Airfit, which is a silicone cushion. And you'll notice, taking them apart, there's a frame piece that you hold right here, and then the cushion is this whole piece. A lot of times people think the cushion is this outer piece on there. That's what interfaces with your face, but it's that whole piece. When you get a new cushion, that's what you'll be throwing away and putting a new one on in its place. But I usually hold it right by the hard frame piece and then push it in. Sometimes you'll get a snap, sometimes you won't. If you gently pull it back and it stays on there, you've got it in a good place. As far as disassembling it, you can squeeze this as well. Your tube's gonna have this sitting in there. Now, if you do have a tube that you're switching masks, and all of these masks have a mask guarantee, and you'll notice on this particular mask, a lot of times you're gonna disconnect it right here. But if you do switch masks, always make sure that the swivel adapter, in this case it's this piece right here, comes out of the tube. And it's just basically like breaking a twig. It's a friction fit, pop it off there. So if you need to use the restroom in the F20 or talk to a bed partner, you can squeeze this and it will pull out. It's easier to breathe too. If you're talented, you can scratch your nose up through there and that just snaps into place. As far as fitting goes with this mask, it can be a little tricky. It's very picky on its placement. I found that it seals up very well even on high pressures when you have it seated properly. So I'm gonna pull this out so you can hear me just a little bit, and I'm gonna flip sideways. First thing I noticed with this particular mask is placement on the nose bridge. So I'm gonna flip it sideways again so you can see here. One thing that people want to do on this mask is they want to pull it down on their nose bridge here. When that happens, you'll notice this gap's right there. And so you'll get a lot of air leaking into your eye. So people will tighten the mask and it pushes in. They're still getting a lot of leak there. You want to make sure that this goes right in between your eyebrows, almost with your nose bridge. It's going to feel high, but I always tell patients if they touch here and it's right in between their eyebrows, that's about where you want it. And you'll notice no gap there. And that's the biggest thing I've seen with the F20 is make sure it's low, it's high enough and not too low on your nose bridge. The bottom piece should sit right in the crease of your chin. You'll notice if I open my mouth here, it flexes with me. Make sure you've got the right sizing from your home care provider. Obviously, as you can see, I'm a medium here. Now, if you hold this in place, you can adjust the straps. I always tell people to hold this and take the slack out of the straps as you're adjusting your mask, especially with leaks. If you wake up to a mask leak, take one hand, press the mask in, and then take the slack out of the straps. Get rid of some of the big slack here. And you'll notice you do want to adjust this mask, put it in very even. Make sure all the sides are even there. And again, on your higher pressures, if you wake up to a mask leak, push the mask in, take the slack out. You'll notice I'm not taking a lot of slack out there, but just a little bit. Switch hands and adjust. You want the mask to go in very evenly. You'll notice the top piece goes about 2/3 of the way back. It shouldn't sit back here. It shouldn't sit too far forward. Sometimes I get people putting it kind of on their forehead and it sends the mask, it puts it off and you'll get mask leaks on it. To take it on and off, you'll notice I put it on, it's very easy. You just get clips and it's going to pop in place. To take it off, if you just roll that magnet right off, it comes off very easily. But you'll notice also when it's on there, as you pull backwards, that really stays in place. But all you got to do to take it off is just roll it gently off there. The other piece, so with the foam cushion, as far as maintenance and care, you don't necessarily need to clean this. In the manufacturer's manuals, it says it doesn't need to be cleaned. If you want to wipe it down gently with like a CPAP wipe, a baby wipe, or a damp cloth, they say to go ahead and do that. The silicone cushion, you do want to submerge with warm soapy water. And the reason being is because you'll sweat in it. Same thing, same fit on the silicone. You want to make sure it's high enough. But as this gets oily, it won't blow out and grip your skin like it should. The other thing you want to do for any mask fit is wash right before you go to bed, right where the mask is going to seal. If you like to wear skin cream at night, just to moisturize or anything like that, you can put that on, but what I always tell patients is put it on about an hour before you go to bed and then wash right where the mask is going to sit, and you'll get a better seal that way. What will happen is if you don't, you'll get kind of an oily film on there, and it makes the mask so it won't seal. The other thing too is you do want to wash this on a daily basis if you can. If you miss a day, not too big a deal. But the easiest way that I've found is if you pop this off your mask, as I showed you earlier, and take it in the shower with you, keep a little bit of a Dawn dish soap to get it on your fingers and just kind of wash it to get the oils off of it and rinse it out real well. It should have kind of a sticky texture after you're done washing it. As far as the rest of the mask, to make it easy, the manufacturer says to get out brushes and scrub it. Most people probably won't do that. I would rinse your elbow out at least once a week. You can, if you'd like, leave it attached to the tubing, or actually leave it attached to here. The other piece you want to do, and I've seen this happen a lot, where patients will not necessarily wash the headgear or the strapping on it, and so it gets oily and it loses its Velcro stick. So once a week, I would just leave this where it's adjusted, but take it into the shower or the sink and do a hand wash. I like laundry detergent, so like a liquid laundry detergent on there. It pulls the oils out of it, but you can use a liquid dish soap, something to get the oils out of it. Wash your cheek pads here and your frame out. Even on the foam cushion, you can wipe the inside out with a CPAP wipe or a damp cloth to get the inside clean. But do that once a week. Try and do it daily on the cushion. And that's cleaning and maintenance of the F20 on that.